diagnosis. Maybe. First session, I think I have a problem. I come to see you.
Okay.
Yeah.
Okay. Well, I'm in private practice, so I'm very aware in private practice we have to charge certain fee. So then some people, definitely the financial circumstances, will prevent them from accessing our services. But again, this is where actually Malaysia, we are not too bad. I think today, back in 25 years ago compared to now, I think the last 5 to 8 years, a lot of good services has emerged, yeah, in terms of services rendered by non-profit organizations like Souls Health, and also in terms of our Ministry of Health. I'm sure Dr. Hanif is smiling at me because we are talking about the Mentari Clinic, yeah. And he was just sharing with me unofficially just now that we have 23 Mentari clinics all over, under KKM, that our community can actually access the service where they have counselors, clinical psychologists and psychiatrists, yeah, at that one clinic, so that you can be attended to, assess and get the proper intervention, yeah, instead of hunting around like, who should I see, counselors, clinical psychologists or psychiatrists. So, when Mentari Clinic came up several years ago, I was one of the happiest ones because I could refer somebody that has sent inquiry to me, but they have financial problem. So I usually send them to the Mentari clinics or to, of course, non-profit organization that runs mental health services that have shown their credibility and good services to the community.
What's the scale, price scale, and how much are they? Because people are concerned.
Yes, yes.
If I have a problem, do I have to refinance my house? Do I have to sell off some things to get help?
Yes.
How much is a simple diagnosis? Maybe? First session, I think I have a problem. I come to see you.
Okay.
Yeah.
Okay. I would say that just like actually all the three parties, yeah, the counselors, the psychiatrists, and the clinical psychologists, because we are governed by different act.
Yeah.
Counselors.
But it follows a certain rate.
Yes,
okay.
There's a range. So we need to charge within the range. Yeah. So therefore, I would say that the range, I could only speak for my own profession, right? And my own profession, in fact, we are still young in terms of the Allied Health Act that was just approved by the Parliament in 2017,
right.
December. So, in terms of our own profession, not only clinical psychologists, the 23 profession, nutritionists, dietitian, occupational therapists, there are 23 allied health professionals, including clinical psychologists. Our governing range of fee, I would say between 100 to about 300 plus.
Right.
Yeah. So I dare not firm it because even the council, we have not really firmed that. But what I would like to assure the public is that, definitely we are moving towards the direction, just like the Malaysian Medical Association, right? All the medical doctors must charge within the range that is fixed by the, medical association. So I believe the counsellors too, you all have a range of fees. So I would say, JD, it would range in private practice from 100 to probably, to be safe, maybe 350.
Okay.
That range.
Because sometimes a fear of the unknown, I don't know how much it is, also stops people from even taking a first step to actually getting some help.
Yes.
So it's good to know roughly how much. So that's private practice. Now, Dr. Hanif, we talked a lot about Mentari. Let's get to what is Mentari, and obviously it's free. Is it safe to say that?
RM1.
RM1. Okay.
Actually, before that, Jerry, I think one of the ways to approach that, I think, would be easier if we categorize that as a government sector, private sector, and so NGO, non-profit. You want to have where to go to if you have some sort of issues in terms of mental health. And if you go into the government sector, there are two ways to do it. First is you go to any clinic you have running, and you can go there and see a doctor, and the doctor will be seeing you there. And if it's needed, they will refer you to a government hospital, which is the hospital where they have not Mentari, but psychiatric services. So they refer you to a psychiatric clinic. That's one way to do it. Another way is for you to go to designated Mentari. They have more than 20 Mentaris all over Malaysia. So you can go there and get yourself screened and get an appointment to see a doctor. And the doctor will screen you and see whether you're experiencing any mental health issues or not.
Yeah.
If you only need some sort of psychological consultations and supportive therapy, they will refer accordingly. If you need medication, then start prescribing you with medications and eventually refer you to psychiatric clinic and stuff.
Right.
So that's on government side. I think on the private sector, what
Yeah.
I mentioned by me and just now, I can go also to websites, various websites.
Right.
I can go there and have a look and call them. Mentally, generally we do two things. So mentally we do screening.
Okay.
Screening. Another thing is we do rehabilitation activities, basically for people with severe mental illness. So the idea is we want to get them back to working environment. So the problem is we lost productivity when we have severe mental health illness, such as bipolar, schizophrenia,
Yeah.
and people with very chronic mental health illnesses. So what we're trying to do is we're trying to bring them back to the job market. So we have a job coach, we train them mentally and bring them to the community, and we assist them during their journey to get a job.
Reintegration.
Reintegration to the community.
Okay.
At the same time, we also have another services, which is the screening services. That's where when people have mental health issues, they can always walk into Mentari and get themselves screened.
Okay.
Now, I know there are a lot of questions, but I have a lot of questions myself because KKM, and I know a lot of people who actually go through this, they always say there's a long wait time. Is that true? Do they have to wait a long time? I know it's only RM1, but is it like an arduous process to get help because you have to go to the KKM first and only you can get help? Is it hard?
I don't know, based from my experience, also my patient's experience, having Mentari is such a shortcut, really. So basically, you can just call in to Mentari, get yourself screened, and you can straight away get an appointment. Certain Mentari allows walk-ins, certain Mentari gives an appointment in less than 2 weeks' time. You can just get yourself an appointment in less than 2 weeks' time. Or another way is to go to clinic kesihatan. That's a bit longer than the Mentari approach. But then again, usually it's less than 6 weeks.
All right. Also, one thing that I know of is that you can actually get in touch with Hospital Bahagia, which is actually in Ipoh, and they have an outpatient system there.